Hi, this is Jane, and on today's Healthier You, we're going to talk about the differences between dysphoria and dysmorphia. All right, let's start with the medical disclaimer. Always check with your physician before starting any exercise or dietary program. Information here is my personal research into different health topics and is not to be considered medical advice. When discussing mental health, it's important to understand that body dysmorphic disorder refers to a specific condition distinct from gender dysphoria, which involves an extreme concern with one's physical appearance, whereas gender dysphoria is a condition in which a person experiences significant distress due to a mismatch between their gender identity and the sex they were assigned at birth. The words dysphoria and dysmorphia may sound similar, but they are two different things. The following explains some of the differences between body dysmorphia and gender dysphoria and how they're addressed, as well as how to find support if you need it through means such as online therapy, which this article actually comes from one of the institutes for mental health. So, dysphoria versus dysmorphia, gender dysphoria or body dysmorphia. A significant difference between body dysmorphic or disorder and gender dysphoria is that body dysmorphic disorder is a mental health condition, whereas gender dysphoria is not. And there are some psychologists and psychiatrists that disagree with this. However, gender dysphoria refers to a sense of unease that a person may have if their true gender identity and biological sex don't align. Gender identity is a sense of gender that a person has about themselves, which may or may not be the same as their biological sex at birth. What is body dysmorphia or body dysmorphic disorder? Body dysmorphic order, or BDD, is a mental health condition that is diagnosed under the category of obsessive compulsive and related disorders. Body dysmorphic disorder is a condition characterized by the following criteria: preoccupation with one or more perceived flaws in one's physical appearance that are not observable or appear minimal to other people. This can be virtually any physical feature. Focus on appearance or body image can be very intense. A perception that a flaw is significant or very negative. A person with BDD may look in the mirror, see something small or unnoticeable about their appearance, and perceive it as a major flaw that's embarrassing and shameful. For a person living with BDD, even looking in an ordinary mirror can seem like seeing a reflection in a funhouse mirror. Repetitive behaviors such as excessive grooming, checking one's appearance in the mirror frequently, skin picking, reassurance seeking, or appearance-based comparison to others in response to the perceived flaw or concern. Clinically significant distress or difficulty functioning in work, school, social situations, or other basic life activities due to the perceived flaw or appearance-related concern. So when you have this, you're actually very obsessive compulsive. It's not something that, like, you look in the mirror and you go, I don't like my nose. If you're obsessed with it and you're constantly looking for reassurance about your nose, those kind of things, it's a problem. And when I think of body dysmorphic disorder, I think of, the billionaire woman that has had all those surgeries and all the Botox to change her face like a cat. That's what I think of when I think of body dysmorphic disorder. I also think of Nancy Pelosi with her constant need for Botox. That is one of those things. BDD is diagnosed when symptoms are not better attributed to another diagnosis or condition. Having a blood relative with BDD or OCD can be a common contributing factor to developing the disorder. BDD can impact your life and ability to engage in activities, including work, school, and social activities, in serious ways. Someone with BDD might cancel important activities, plans, and experiences in daily life due to their symptoms, including their behaviors or distorted view of their appearance. Body dysmorphic disorder can be hard to live with, and it's common for people with body dysmorphia to experience feelings of anxiety, depression, and low esteem. If you struggle with BDD or think that you might, you aren't alone, and the good news is that there is help there. Roughly 1 in 50 people are said to live with body dysmorphic disorder, and the age onset tends to be around 12 to 13 years of age. BDD is successfully treatable through forms of talk therapy, such as cognitive behavioral therapy, which is called CBT. If BDD is impacting your life or you think you might have BDD, it's important to reach out for help. Dysmorphic perception of the body and eating disorders. Body dysmorphia and eating disorders aren't the same things, but they do have some similarities. Each is a mental illness or psychological disorder that is related to feelings about or the perception of one's body, which can manifest as uncontrollable thoughts. Both tend to be associated with distressing and uncomfortable feelings about the body. Both frequently affect daily life. Another similarity is that people with body dysmorphia and eating disorders tend to have preoccupation with body image and may experience a distorted body image. But while a person with an eating disorder typically is concerned with body size and shape, a person with body dysmorphia may be focused and anxious about a specific body part. Addressing eating disorders and anxiety. Eating disorders include anorexia nervosa, bulimia, binge eating disorder, and more. People with eating disorders can have coexisting body dysmorphia and vice versa. An eating disorder is a mental health disorder and can also be indirectly or directly linked to other mental disorders, such as anxiety or depression. If you or a loved one has an eating disorder, please reach out for help. Bulimia treatment, binge eating disorder treatment, anorexia nervosa treatment, or treatment for any other eating disorder, please know there are treatments that can help you live a healthy life, both physically and mentally. Now, with all my years of working with people in mental health facilities, psychiatric, that kind of things, I disagree with the idea that body gender dysphoria is not a mental health issue. It is. Because I see similarities in the symptoms. Gender dysphoria is a common experience among transgender people, although not every transgender person experiences gender dysphoria, and symptoms can be unique to personal experience. Many individuals who experience gender dysphoria suffer from significant emotional distress, as they may feel trapped in a body that does not align with their true gender identity. Be interesting to see how this works with body Louis syndrome. The American Psychological Association defines gender dysphoria as clinically significant distress or impairment related to a strong desire to be of another gender, which may include a desire to change primary and/or secondary sex characteristics, while noting that not all transgender or gender diverse people experience dysphoria. The gender a person identifies may not be the same as their biological sex. Some people call one's biological sex their biological gender, but gender is the identity, expression, and societal expectations, while sex is a label based on genitals and chromosomes at birth. For instance, a person whose biological sex was female at birth may have been born with the male biological sex, but their gender identity may not be male. When a person feels their true individual gender is, there can be very unique and personal. Male and female aren't the only genders people identify as either. Some may have non-binary gender identities, while others may have fluid gender identities. And quite honestly, those that feel like they're dogs, cats, foxes, whatever, do they fit this? Something to think about. Understanding gender dysphoria and its impact on mental health. Gender dysphoria is often an incredibly distressing experience for a transgender person, as it can create an intense internal conflict between one's innate sense of gender identity and societal expectations and norms. Gender dysphoria can start in childhood, continue into adolescence and adulthood. It is often described as stemming from feelings of being trapped in the wrong body, although wrong body is not always the preferred term. It can be a sense of the biological sex of a person's body not matching their gender identity, which can be a difficult reality to navigate and can cause unease, discomfort, social isolation, and other symptoms. Gender dysphoria is often linked to mental health complications, such as extreme feelings of anxiety disorder, and depression. While gender dysphoria and body dysmorphia are not the same, people can experience both gender dysphoria and body dysmorphia. This could mean asking people to use the pronouns that align with a person's gender, style of dress or apparel that makes someone feel more comfortable, a haircut, hormone therapy, facial hair through hormone treatments, for instance, breast size, augmentation for trans women, surgery, voice training, or something else. For example, a person whose biological sex is male may identify with the female gender and want to be addressed with female pronouns. One gender person might want surgery and HRT, hormone replacement therapy, whereas another transgender may want neither or only one of those things. When a transgender person has support and can live as themselves, whether it does or does not involve things like medical transition, mental health outcomes are highly improved. Support from mental health professionals, medical professionals, family, friends, and community at large. Additionally, the transgender community can be extremely important in supporting the mental health of transgender individuals. Find a therapist to enhance mental health and reduce anxiety. If you are looking for someone to talk to, a counselor or therapist can help. There are different ways to find a therapist near you or online. You can search the web, ask your doctor for a referral, or contact your insurance company. So, I will tell you there is a 2019 study found that internet-based cognitive behavioral therapy is effective for the treatment of BDD, while also increasing the availability of mental health services to individuals. A recent 2021 study focusing on internet-based gender-affirming cognitive behavior therapy for LGBTQIA+ youth and young adults found it not only to be effective for helping to treat the mental health challenges often experienced by those in the LGBTQIA+ community, such as depression and anxiety, but participants also reported significantly reduced depression symptoms and improved stress appraisal and coping skills. According to the researchers, these findings suggest that digital technologies are a promising platform for the delivery of affirmative therapies for LGBTQA+ populations. Support for body dysmorphia and gender dysphoria. Finding an LGBTQIA+ affirming provider who works with trans people as a demographic. Well, I need to start over there. Finding an LGBTQIA+ affirming provider who works with trans people as a demographic may be advantageous for those who need a safe space to talk about dysphoria and feelings related to gender and other similar concerns. Some therapists and counselors specialize in working with body image, body neutrality, body perception, body dysmorphia, body image, distortions, eating disorder recovery, and obsessive compulsive disorder, among other disorders. You deserve to find quality care that meets your needs and helps you live a happy life. So don't hesitate to start that search. Here's the big takeaway. Body dysmorphia or other body dysmorphic disorder is characterized by the individual focusing excessively on a part or parts of their body that they perceived as flawed, often to the extent of interfering with their day-to-day life. Gender dysphoria, simply put, can be experienced when someone's genitalia that they were born with does not match their gender identity. Both of these can be difficult to live with and work through, but it's important to note that while body dysmorphia is a mental disorder, gender dysphoria is not. No matter who you are or what you are experiencing, you matter. Your identity is yours to define and yours alone, and you deserve help and support when and where you need it. If you're ready, you can take the first step to being treated by an experienced, empathetic, and knowledgeable therapist. Now, there are so many similarities between these two. You have body dysmorphia that talks about their body being flawed, that there are flaws within their body. Gender dysphoria is the same thing, in my opinion. You have the thoughts that your body is not what it is. That is a flaw. So, I know I have trouble with that, and some of the psychiatrists that I have worked with in the past also have trouble with that, and they've written several papers on it, that they are both mental health issues. Although we have a group of people that are telling you it is not. So, it's kind of up to you what you believe. But yeah, I do believe it is a real issue in our world today. And I think that many times people are not given the psychological, psychiatric help that they need to deal with either one of these. So, yeah. And that is my opinion on that. All right, guys, that's it for today. See you again next time. Next week, we're going to talk about puberty blockers. They are used for a lot of the gender dysphoria issues, but there are some legitimate medical reasons you would actually use body puberty blockers that are totally different than if you're transitioning. All right, guys, that is it for today's video. I know it's a tough subject, but it's one we need to look at. All right, see you guys soon.